Hi everyone, I wanted to give you all a quick overview of all of the exciting things that are happening in the world of CRC or colorectal cancer research. To get us started, we can talk a little bit about the diagnostic studies for CRC. So CRC is unique in that it often develops without noticeable symptoms at first, making it difficult to detect without early screenings or regular screenings. And screenings are important because they can detect precancerous growth, such as polyps, at an early, more treatable stage, which can significantly increase the chances of successful treatment and cure with less invasive and more effective treatment options at your disposal. The recommended age to begin screening vary depending on your risk factors, such as family history or prior medical history, but generally screening should be started at around the age of 45 for an average risk individual. So currently patients first take a fit stool test every 2 years, and if that comes out positive, they follow up with a colonoscopy. However, there is a study in the US that's currently recruiting for healthy participants that is looking to develop a blood test that will look for mutations in the cell-free DNA. So DNA that's actually floating in your bloodstream and not necessarily within cells. It'll test that DNA to see if it has specific mutations that correlate with CRC or colorectal cancer. Positive tests would indicate the presence of CRC, which should then be followed up and confirmed. And this is a really cool study for healthy participants involved and to help further CRC research. Moving along, those who have already been diagnosed with CRC, let's talk about what type of treatment trials are available for them. So roughly these trials can be split primarily into the main treatment areas. So for example, one avenue for treatment is surgery. So there's a few trials looking at how to improve surgery outcomes and recovery for patients. Most people with CRC will end up having surgery, so as part of their treatment. So the surgeon will go in and try to remove as much tissue as possible, as much cancerous tissue as possible, which can vary depending on the stage of cancer. So for some folks, that's just a local excision to remove abnormal tissue. For others, it's a full bowel resection that removes part of the small or large intestine. You can imagine it can be quite difficult to delineate the difference between cancerous and healthy tissue. So right now, surgeons rely primarily on tactile and visual cues in order to figure out and delineate those boundaries. A lot of the surgery trials are currently looking at how to better visualize and, as a result, remove as much cancerous tissue as possible, as safely as possible. So a surgery trial, which is currently recruiting in the US and in Europe, is looking to help surgeons remove as much cancerous tissue as possible by administering a drug called SGM-101, which is a fluorescent marker antibody that targets something called carcinoembryonic antigen, which is made by tumor cells. So the drug is administered through an IV, and then during the surgery, the surgeon is able to use fluorescent imaging to actually cause the cancer cells to pretty much light up, making it a lot easier for surgeons to see and remove the cancerous tissue. So as exciting as that trial is, it seems a lot of the major waves the CRC space are actually being made in immunotherapy and targeted therapy. So when a patient undergoes immunotherapy, the drugs they are administered are actually looking to help or strengthen the patient's own immune system and the immune system's ability to fight so that it can attack cancer cells itself. It can also be used in combination with chemotherapy and other types of therapies. So a lot of the studies in the immunotherapy space are looking at its combination with other therapies to see if that produces better results for patients. Targeted therapy, on the other hand, is another developing treatment option that uses drugs to target specific molecules on or in cancer cells. Usually a good target is something that's responsible for sending signals to tell the cells to grow or divide. So by targeting those specific molecules, the cell stops growing and the spread of cancer is limited. So similar to immunotherapy, targeted therapy can also be done in combination with chemotherapy or other types of therapy. So a lot of the studies in this space are also looking at best regimen practices for patients. So a targeted therapy trial that's currently being conducted is currently recruiting throughout the US, Canada, and the rest of the world, and it's looking at the effectiveness of combining two drugs called tucatinib and trastuzumab, with targeted therapy drugs, with a chemotherapy regimen in HER2-positive CRC patients. So with certain types of cancers, there tends to be mutations that are consistent within the population. So one that I mentioned for CRC is called HER2, human epidermal growth factor receptor 2, which most folks associate with breast cancer, but it's also present within the CRC population. And this gene is actually involved in the control of cell growth and survival. So a positive mutation means that you have an increased number of this gene and produce too much of it, which can cause cancer by changing the normal cell growth and survival pathways. So in this case, this clinical trial, targeted therapy drugs actually attach and block the HER2 receptor, so it stops the cancer from growing and dividing. However, HER2 positive mutations is not actually the most common type of mutation in CRC, and it only accounts for about 3% of cases, but there are a lot of studies in targeted therapy that are also looking at more common CRC mutations such as KRAS, which is about 40% of patients, BRAF, which is about 10% of CRC patients, and all of these studies can be found on healmary.com. Now, let's say you have already undergone treatment for CRC. There are still a lot of studies that you can choose to take part in that are looking to minimize the risk and reoccurrence utilizing a new test called the Signatera test. So the test was recently just released for clinical use in 2019. Can be used to predict relapse with an overall predictive value of 98%. So in order to actually do the test, they first create a personalized analysis of the patient's blood and tumor sample to determine the unique set of tumor mutations that person has. Then the patient can undergo routine blood draws to see if that unique tumor DNA is present within their bloodstream, and a positive result would indicate a high likelihood of reoccurrence or relapse. So the test is being used in adjuvant settings after surgeries to determine the necessity of chemotherapy, which just means whether or not additional chemotherapy after the surgery is necessary to prevent relapse, and is also used in surveillance settings to monitor patients as they have recovered from CRC to catch the possibility of reoccurrence as quickly as possible. So there's clinical studies that are currently looking at developing best practices based on test results. So one interesting study is leveraging this test and recruiting patients throughout the US, and is evaluating the adjuvant use of the test to see what kind of chemotherapy to recommend to patients based on a positive or negative test result. So they're looking for patients that have recently undergone surgery and will then undergo a Signatera test to determine the status of tumor DNA circulating in their bloodstream. So those with negative test results are split into two groups, one that receives chemotherapy and one that undergoes no treatment, just monitoring. And those with positive test results are also split into two groups, which receive 3 different combinations of chemotherapy drugs. It is primarily measuring how long it takes for any sort of reoccurrence event. So super interesting because it will help future patients know exactly what regimens may give them the best outcomes based on the status of their tests. Now, this is just a small taste of the research that is being done in regards to CRC. So I really only got to talk about 4 different studies, but there's tons of research being done in this space, looking at new molecular targets, drugs, treatments, and earlier detection of CRC as well. Now, there's tons of reasons to get involved in clinical trials. So regardless of where you are in your cancer journey, as you can see in just the 4 studies that I've talked about today, maybe a clinical trial that can help you improve outcomes for yourself. It allows you to get therapies which are not yet available to the general public, and therapies that may be more specific to you and your type of cancer. Be a way to keep the momentum going in the cancer research space so that researchers can continue to develop more effective and safer treatment options for those that may come after you. So regardless of where you are in your journey, it may be helpful to get a feel for what's out there and talk to your doctor about whether or not this is an avenue that you can consider. And definitely go to healmary.com to help you get started with your search.